Yeah, I'm at Walmart picking out a puzzle for myself. I'm pretty bored these days. Yeah, I have one. I'm gonna be home in 5.
Sorry, I couldn't help it over here, but my name's Jenna and I'm an occupational therapist, and I saw that you're looking for puzzles to do now that you're a little bored. And I have a great assessment that I think you could use that to give you some more activities that you can do for retirement.
Oh, really? I'm interested in learning about this assessment.
Yeah, so this assessment is called the Leisure Assessment Inventory, and it is a tool that utilizes 4 indexes to evaluate leisure behavior in older adults. There's 4 different components. The first one is the Leisure Participation Index, and it measures activity involvement in current leisure functioning. The second is the Leisure Preference Index, and this measures activities that you would want to increase participation in. The third one is the Leisure Interest Index, and this measures the degree of unmet leisure participation that you would like to complete. And the fourth and final one is the Leisure Constraint Index, and this measures the degree of external and internal constraints that you may have that limits your leisure participation.
Oh, really? How would this assessment help me?
The Leisure Assessment Inventory is to help healthcare professionals, like occupational therapists like myself, and caregivers to successfully use leisure to not only develop your leisure skills, but also to promote physical fitness and health if you choose to engage in physical activity. It also helps you develop friendships if you are looking to increase your social load once you are retired. It also helps facilitate community inclusion if you were to go out into the community and complete leisure activities with others your age. It also helps prepare for retirement, so for those who are retiring around 60s or 65, this helps you find activities so it decreases the likelihood of depression or unhappiness once you do retire. It also helps you empower self-determined lifestyles where you get to choose activities that you enjoy doing. And it also fosters social networks within residential communities, and that is if you were to live in a retirement home later on, and this would help you just engage in activities that bring meaning to your life.
Where do I fit in with this assessment?
So this assessment was originally made in 1997, and then it was only used for older adults with mental retardation or developmental delays, and it's for adults who are over 50 years old. And today it's still utilized for adults who are over 50 years old, but it hasn't brought into any adult can use it. They don't have to be diagnosed with a mental delay or anything like that. So there are some strengths and weaknesses to this assessment. The kit uses 50 plus individuals in the pictures, and it makes it more specifically appropriate for older adults, and it has more accurate results in the testing. It is also important for individuals this age to have explore activities that they can do when they retire. So this is very effective in finding leisure activities that one can participate in once they retire. And the weaknesses include that in the 52 pictures that are included in the assessment, it could leave out some leisure activities that are not included in the assessment. And this could leave out some leisure activities that you may be interested in participating. Also, the test is limited to people who are over 50. And this is a strength in the test, but it does leave out a significant amount of populations that could use leisure activities in their life. It also, the test is slightly expensive at $240, so this can be difficult for some locations to get if they don't have enough money. And also, the 45-minute duration of the assessment could be considered a little long for someone who has developmental delays. This assessment includes 52 cards that have individualized leisure activities on them, one user manual, and a license, so when you do go find an occupational therapist, they have a license so they can copy other score sheets additionally to the 2 that they come with. Once you do find a therapist that will help deliver this assessment to you, there's a lot of things that it will tell you about yourself. So the first one is your current leisure functioning. The second is what leisure you would like to increase participation in. So these could be any kind of activities that you want to participate in but haven't yet. And the third one is constraints to your leisure participation. So these could be anything from you have enough money or you don't have enough money to participate in this activity, but you would like to still participate. So this is a 2-part assessment. Part 1 assesses current leisure participation by asking you a series of questions that go along with the 52 cards. And part 2 goes along with the constraints, and it finds out what constrains you from participating in those leisure activities on the cards that you can't participate in. 4 scores are given based on your responses in part 1, and in part 2 there's a score of 0 for no and a 1 for yes. Additionally, this assessment is related to the occupational therapy practice framework, where it explores leisure exploration and barriers to leisure participation. And all together, this assessment helps with social participation as well, where you can socially participate with other individuals while exploring leisure activities.
Wow, I'm really interested in what you just had to say. I will look for the nearest occupational therapist.
Yeah, it was really nice to meet you. I hope this helps you out in finding more leisure activities that you can participate in.